Kirsten, shall we take it away?
Sounds good.
All right. Welcome, everyone. My name is Tanya Richmond. I am your trainer for today, and I am joined by one of my favorite people in the world, Kirsten Sankirko, who is going to introduce herself, and then I'll kind of roll us out.
Thank you, Tanya. And I would agree, one of my most favorite people in the world. I have had the pleasure and honor of working with Tanya along with many other people who are thinking and practicing person-centered practices. I primarily work in New York at the New York Alliance for Inclusion and Innovation. And I typically focus on workforce advancement and direct support professionals and all that we can do to support them. But I also happen to be the executive director for the Learning Community for Person-Centered Practices. And that's just a group of passionate volunteers who like to come together and share best practices. I'm excited to be with you here today, and I'll be managing the chat. We do have a robust agenda, so if you do have questions, we ask that you put them into the chat, and I can answer your questions while Tanya is covering the material. And I will also be popping in our handouts for the training in a moment in the chat for all of you in case you don't have them. But thank you for joining us. Take
Thanks,
it away,
Kirsten.
Tanya.
Thanks, Kirsten. So I am in Greensboro, North Carolina, where today it is the yuckiest, rainiest, but most beautiful November day. It's exactly what it should feel like, I think, pre-Thanksgiving. And I was just sort of lamenting that I would like to be wrapped up in a blanket. But if I had to pick my second favorite activity, it would be doing this training. So here we are. I am with a small consulting firm called the Learning Community for Person-Centered, called Support Development Associates. I'm a partner in that firm, and we are a person-centered consulting firm. We do policies, practices, a lot of training. And so I've been doing this for quite a while in that environment. But before that, I was a clinical social worker and still am and have been for about 30 years. And I always say I wish I could go back and do the first half of my career over, get a do-over for that. Not because I was a bad social worker, but because I wasn't intentionally using person-centered practices, maybe accidentally using them sometimes. And certainly they've made a big difference in my career, in my life, in the life of the people that I love, in the life of the people that I support and serve. So I'm really excited to talk to you about that. I'm also the co-chair of the Learning Community for Person-Centered Practices, and am just really steeped in this work, and we want to spread it as far as we can. So we hope that you'll find some value in the training today. Most people really like it. And I will say that what we teach you here, you can immediately apply, which I think, today's Tuesday, it has Tuesday applicability. So as soon as you leave here, you'll be able to do some of the things that we talked about today, which is one of my favorite things about person-centered practices in general. So what we're talking today about is our person-centered planning standards and allowable modifications, the challenge of choice, and where we are now, but all of that with a lens of management. So thinking about our person-centered skills, using our person-centered skills in a management or administrative capacity. And I'll give you some ideas about how that may be different in using them when we talk about supporting someone in a direct way. The other thing I didn't say, just to kind of back up for a second, we are partnering with the Department of Health in New York to roll out this training. And this started around right before the pandemic, maybe a year or so before the pandemic. We were doing training in person. And of course, then everything had to go online. So the trainings are shorter now. They're 2 hours, but we feel like we have a really nice broad base of good person-centered trainings that are connected to what we would have done in person with folks in New York. And in addition to that, in the coming year, there is some hope that we're going to be back in person with folks again. So that may mean a new change in training topics as well, but all of them will be person-centered focused. So I just wanted to acknowledge that they've been really good partners to us, and it's been great to think about all the wonderful things that are going on in New York around person-centered practices. So today, as I said, we'll talk about management skills. We only have 2 hours today to explore this. And we also have to kind of overlay that with the current reality of providing services and supports at a time of great change in our systems. So even though that's all true, we're still supposed to be person-centered in the way we behave and the way we function on a daily basis. And I know that for many of you, you're like, that's where the real challenges are, because there is the reality of staffing shortages. There is the reality of restrictions on what we personally do on a daily basis, because we're still responding to kind of waves and surges of the virus and rules that change as a result of that. So we'll talk a little bit about that as we go through our time today, and we'll also give you some additional resources. If you are a manager, if you're an administrator, and you'd like to use these skills more in depth, there's certainly lots of resources for you to be able to look at it to do that a little bit better. It is unusual for us to run into anybody who has not done everything on Zoom at this point, but just in case you haven't been in an engaging training in a Zoom environment, and that's what we hope this will be for you. It's helpful if you mute your microphones when we're in the main room together, unless we're asking you questions. Then by all means, turn your microphone on, talk with us. We love hearing your voices in those situations where we have questions and where you're talking with one another or us. And you'll certainly be talking with one another in the breakout room. So turn your microphone on and off at will. You are able to do that. We don't put any controls on your computer, so you can do that just by clicking on the icon that looks like a microphone that turns it on and off. When it's red, we can't hear you. When it's white, we can. If you can turn your camera on, that's great. We love seeing you. It's helpful just, I think, in building rapport with one another, building trust with one another, and certainly in the breakout rooms, it makes the conversations much more interesting. That said, you are here on all kinds of equipment that presents challenges. Some of you probably don't have functioning cameras or microphones, or the camera slows down your internet speed. And I know all the permutations of reasons that the camera and the microphone may not work. And that's okay. We'll take you how you are. But what does work for everyone, and in the expectation in the absence of those two things, is that you will use the chat to communicate. So if you cannot use your microphone, please use the chat. And that means if you're in the breakout room and it seems suspiciously quiet, instead of ignoring one another, everybody look in the chat box, because maybe everybody's talking there. And if no one's talking, start it, please. So that's how we're going to kind of get through our time today and have the most success. The only other thing I would remind you of is that we are going to ask you to participate in some breakout rooms. So we'll give you instructions a couple of times during the training. And that requires a little bit more of you than passive listening. So if you are attending a meeting, taking care of children, and doing two other things while attending the training, you're going to have a hard time today. So please, if you will, just listen for instructions. We'll tell you when you're going into the breakout room and what questions we'd like you to work on together when you're there. When we say engaging, it takes a little bit more than passive listening. So we'll ask you to just pay attention for that, and we'll tell you what to do when we get to that point of the training. And that is our expectation of you, just for in terms of using the platform. I'm going to give you a few more things to think about in terms of just meeting agreements in just a moment. It is helpful, though, for us to know who's here today. So if you will, just respond in chat, find the thing that looks like a cartoon chat bubble that would show up over someone's head, and tell us who you work with. Think in broad sweeps. So you might say, I work with older adults who have dementia, those kinds of things. So let us know who you work with. That will help us tailor our stories today. And then Kirsten's going to tell us a few of those things once they come in.
Social adult daycare, adults in mental health recovery, some substance abuse and some with medical conditions, elderly personal care services, housekeeping, bathing, older adults that fall under the umbrella of dementia, adults with TBI, traumatic brain injury, individuals with substance use histories, members requiring long-term care home attendant, seniors, disabled, adults with SUD, I'm not sure what that is, and mental health concerns.
Maybe substance use disorder, maybe?
Yeah.
Guessing.
Adults who struggle with substance abuse, yeah. chronic physical conditions, mental health diagnosis, more adult social daycare with deaf, care manager for people with mental health challenges.
So it looks as it usually does. We have people from everywhere, which is great. It does seem that we have a lot of folks who are working with older adults today. And I always say that I actually went to graduate school and focused on working with older adults. About 7 people a year graduate in the United States with that focus. But I am seeing more and more people out in the field doing that work, and it's important work. But all of the work you do is important. I do want to also say to you that you'll hear me use the terms supports and services interchangeably. If you've been in training with me, you probably noticed that. It's really just to kind of be inclusive of everyone who could be here today. If you are more medically facing in what you do, for example, those of you who maybe work with people with traumatic brain injury, you may, because that's more medically focused, you might actually think of what you do as a service. If you're more human service focused, you might think of what you do as a support. And I mean, basically what any of us do with anyone we work with. And I want you to use those terms interchangeably. And if I don't do it as I'm presenting, please just sort of make that translation in your head. It will be helpful just to make sure that it's really talking about all the things we do with the people that we work with, despite who we may be working with. And the great thing about person-centered practices is that they just work for human beings. So no matter who you work with, if they have a pulse, you'll find these skills helpful. Let's move on a little bit. I'll talk to you just a little bit more about our time together, and then we'll jump right into the material itself. It is helpful sometimes to have a few agreements about how we'll spend time together. And for me, the biggest one and most important thing to do is just be present as much as we possibly can. I understand and am also plagued by the fact that people want our attention for a variety of things. There are calls coming in and emails coming in and people who need our attention. And it is nice to be needed. However, you're going to get a lot more out of this if you can just stay present with Kirsten and me and one another throughout the presentation, and do participate in the breakout rooms. That's where, to me, a lot of the learning really happens. It's from one another in those conversations. So it's a place to talk and share. And I would ask that when you go in the breakout rooms, intentionally connect with one another, really do talk with one another. And if you can't use your microphone, use the chat to connect with one another, but do engage. Sometimes because we're talking about, and today we're actually going to talk about how you think things are going at your organization, how you think things are going for the people you support. And it's a hunch, it's not science. It's really more kind of like your best guess about how things are going from a person-centered standpoint. That can feel a little overwhelming or sensitive sometimes. We always have room to improve. So it's not to call anybody out or make anyone feel bad, but it really is to help us understand that we have to have a good baseline of how we think things are going if we're going to make improvements. That said, if you feel overwhelmed or sensitive, do take care of yourself and create space for one another for those kinds of conversations that may feel that way. And if you don't want to talk about something, don't. So just share what you're comfortable sharing. But in addition to that, it may bring up other things. So having a place to put that, which we will call the parking lot, is a good idea. So it doesn't mean those aren't important things. They are important things, but they may not fit in the time that we have together to have these conversations. And then finally, just please be patient with one another. My guess is you're pretty patient based on what you do in the world. But it's still a new way to engage with one another. And I think we've all become pretty Zoom weary at this point. So it's helpful just to be intentional about being present and engaged with one another, and having that stance of just being patient and creating the space. So what we'll talk about today are the planning standards of the HCBS rule. That's going to be a part of our conversation, kind of brief. But then we're going to talk also about the skills that you can use in your organizations to help your organizations be more person-centered, to help you as a manager be person-centered. So let's see, I have a couple, there we go. We're also going to talk about making choices. I've even started to shift my language about that a little bit. So I'll tell you a little bit about the method behind my madness when I get to that. But I'm starting to think of that more of decision making with people instead of helping people make informed choices, because there's something about the way that's said that actually implies it's my choice to give you. So we'll talk about that when we get to it. And I'm also going to talk a little bit about organizational policies and procedures that help us be more person-centered, or maybe steer us away from person-centered practices. All of that so that you can expand your knowledge in person-centered management skills. And we'll look at where we are now. So person-centered organizations are intentionally developed through exploration, through thinking about how our values and our practices actually align in our organizations, how our policies support us to do value-based work. And we're going to look at where you think you are as an organization. This is a first look from your perspective. As I said, this is not science. It really is your best hunch. And it's thinking about person-centered practices in relation to your organization. Then we're going to ask you, once you've had that experience, to go back to your organizations and include others in the conversation and check out those hunches a little bit, see what other people think. There's a number of things that we're going to share with you today that are actually kind of pulled from the regulations. I'm going to share a few of those things with you because I think it helps set a better context for us in terms of why we would want to use person-centered skills in our management practices anyway. And really kind of the reason for that is around alignment, making sure that what we're doing in our policies and procedures supports us to be person-centered in our daily practices. And then I'm going to ask you to think about if things are going to be better, if you could define what success would look like for you, how would things look different? Because we want systems where people have the lives that they want in their own communities as much as possible, but we also live in an era where the demand is increasing constantly, and we have public resources that are fairly limited, and they aren't getting bigger for sure. And it means that it puts pressure on us, which we might consider to be maybe kind of external pressure for us. So we have an internal pressure that all of us feel about being person-centered because it does kind of feed our values and it aligns with what we believe. But there's also these external pressures as well, which is shrinking resources and federal laws that tell us that we have to be. So it means that we have to perhaps do our work differently. We may need to organize differently. We may need to deliver our services differently. And if you think about it for yourself, and you might actually put a few things like this in the chat if something immediately comes to mind, has your organization had to make changes in how you organize and deliver services related to person-centered planning, maybe as a result of the HCBS rule? So you as managers really have to think about this all the time because you're thinking about the limited resources. At the same time, there's an expectation that you're person-centered in the way you serve and support people. And that means that we have to look at change that is real and substantive, but it also needs to meet federal and state expectations. So we have a federal rule overarching us. And at the same time, we have to make sure that people get better lives as a result of using our services and supports, that they have a say in who provides those services and supports. It may also, when we use our person-centered practices, help you use those limited resources more effectively. And it certainly can be a good way to have a dashboard for how things are going. So if you think about your system and how it looks across your system, or you think about your organization and how you look compared to organizations who do something similar to what you do, how are you in the person-centered arena? How are things looking for you? It is also helpful to have some common language around person-centered practices. And this is truly helpful overall, because I think right now in the world, everything is called person-centered. It is not uncommon that people use that term in our medical. I know when I go to my doctor, they tell me that they're person-centered. There's even a poster on the wall. But when I tried to engage my doctor in a conversation around that, it was like she had never heard of it. I was like, it's that stuff that's on the wall. Oh, okay. So it's everywhere. It's expected of us federally, and it gets used a lot in terms of language, but people don't often know what it actually means. So this is a review. You will have seen this if you took the HCBS training, the home community-based services training that we do. But just to kind of give us all common language here, person-centered thinking is about our thought processes and how they shift to help us think about balance from the person's perspective, what's important to them, what's important for them, and how to help them have services and supports that get them a life that reflects that balance better. Person-centered planning is an action that we undertake. It's how we construct a plan, an actual thing, that supports people to not only describe the balance, but also put those services and supports in place so that they can have more of that balance in their life. And practice is something that's more around, person-centered practice is more around aligning our service resources across our organizations and our systems so that we're paying attention to whether or not people have that balance and they're living in lives that they're choosing in their community. So we want to make sure that we're using the same language because it's helpful when we start to think about how does this apply to our organizations? How can we look at where we are compared to where we think we want to be in being person-centered? And there is also this expectation that comes down from the federal government. The Home and Community-Based Services Final Rule or Rule, which became effective in 2014, is about helping people have autonomy in their communities, be involved in their communities, included in their communities, if they're receiving Medicaid-funded home and community-based services, and that covers a whole range of things. And there were person-centered planning standards that were put in place as a result of the HCBS rule that are an expectation of all of the services that are covered under those funding streams. So in New York, it's your 1915C waiver, your community options, community first choice options, the 1115 waiver, which includes managed care and managed long-term care. And the effective a couple of years later was a rolling part of that rule that put in place person-centered planning standards that were similar to that of the HCBS rule for managed care entities. And they also said, this rule also said that these person-centered plans have to be in place for every person who receives services under those funding streams. That the significantly enhanced version of the PCP, most of the conditions were required as of that March 2014 effective date, and that there could be modifications to the rule, which is a very fancy way of saying restrictions, where there is a risk present that we need to address in the plan for a person who has some risk that we're trying to address. And we can do that on a case-by-case basis. And we have until March of 2023. So coming soon to a plan near you is the expectation that you will have these modifications in place if they are needed. And we'll talk a little bit about that as well. We talk about that in a couple of our trainings. So, you know, it's not my first thought when I see a rule come down from the federal government, like, oh, yay, a new rule, a new regulation for me to follow as a social worker. Often, I think our pushback about that, if we are providing services and supports, is that we think it can detract from quality because it focuses more on compliance. And I think that can often be true. I've certainly seen it be true many times in my life. But I think this is something that's a lot different. The HCBS rule is kind of the first time in my career as a social worker of over 30 years where I said, yeah, that really does line up with what I anticipate I want to do with every person that I serve and support. It fits my values. It really is about helping that person have choice and control and dignity and autonomy and all the things that I value in doing the work. And that is really something that's different, I think, about this regulation than other regulations you may have seen. But it is normal, I think, to feel that pushback. And I think that often, I'm going to go back to this for a second, I think that often we feel that way. And so we're automatically saying, oh, we've done this before, or this is not new. This is new. This is not a tweak in the way we provide services and supports. In addition to that, it's our overarching governance. So it really is what helps us govern person-centered practices in the U.S. And the thing that I think is really unique about the project that you're doing in New York and getting everybody trained, or what's happening across our nation, is that home and community-based services and the person-centered practices and planning that underpin that, you're speaking the same language, you're getting the same training in these trainings as the federal government got before they actually developed the policy. That's very unusual. So you have a similar or shared understanding of what our person-centered practice is, because you're being taught basically by the same group of people. The learning community really had a heavy hand in that. But it outlines the standards and the expectations for planning with people receiving services and supports. And the whole kind of underlying reason for it is that we want people to be able to live in their communities in the most autonomous way possible in integrated settings, wherever possible. And we want it to reflect, from the person's perspective, what is balance in their life? What does balance between what's important to them and important for them look like? And I'll go into that a little bit more deeply in just a bit, because that is our person-centered language. It's our foundational concept. And you probably heard it in every training you've ever been in about person-centered practices. I don't know why I'm out of breath today. I think I must be excited about this training. So the plan requirements are that we outline a person's strengths and preferences, as well as their clinical needs, their support needs, and any desired outcomes. And I think as supervisors, managers, administrators in your system, you play a really important role in assuring that plans are of quality, that they're good quality plans that are in place for people. The plan itself is not the outcome. It's, do people get good lives as a result of the planning that they do with your organization? So we use the term in our person-centered world that we keep the person in the center of the plan. And that's a concept that comes from our plan development, but it's really thinking about, what does the person want to accomplish in their life? What's their desired outcome? And my easy way to describe that is desired outcome. That's the kind of scientific word for it. But think about how that person sees their life. Where do they see themselves living? How do they see themselves going through the day? Or what do they see for themselves in terms of kind of that picture of down the road when things are like they want them to look? That's the outcomes we're looking for in person-centered, when we talk about person-centered outcomes. We also have to think about person-centered thinking in terms of more of a checklist, not a checklist, more of not a checklist. So when I think about how people have planned in the past, how I have planned in the past, I was very intentional that everything that would be monitored was very well documented. So nothing in my plan was blank. I made sure that I went down a list of all the things that someone would be looking for, and those were definitely filled in and they were on time and those kinds of things. That's not the motive behind person-centered planning. This is a big shift in the way we do things, because it's thinking about, from a person's perspective, how should life look? And that means that I have to have a different set of competencies when I plan with people, and often have to use approaches that I may not have used in the past. So it's not a small tweak, as I was saying earlier. This for our system has been, I think, a very large shift. And in addition to that, there are a lot of myths out there about what person-centered practices are. The big one, and I think this is really related to people being a little bit in denial about it, is that we're already doing it. And I know the very first time someone talked to me about person-centered practices, my notion was, of course I'm person-centered. I'm a clinical social worker. Of course I am. I already am using person-centered practices. And I think accidentally I was in a few instances. And I think in many instances I was very system-centered. And when I say I was a good social worker, I made the monitors very happy. My plans were probably pretty close to perfect, but they didn't do a thing for the person that I was serving or supporting. They just got services in place, perhaps. They allowed my organization to bill for services, but in no way did I think about how that connected to the person's life or what they wanted for themselves. In fact, I didn't conceptualize it that way in any way. So a good plan doesn't help a person get a good life. In the state of North Carolina, I do a lot of review of plans for the Department of Justice for an initiative we have where we're moving people into the community from long-term care facilities. And I see plans that are perfectly glossy, perfectly laid out. They have everything you would expect a good person-centered plan to have, including just great pictures and descriptions. And then I meet the person whose life it is, and life isn't exactly like it's described. It's not so good. In fact, the person doesn't really relate to the plan that I'm talking with them about. That's not what we're going for. We want people to have good lives as a result of what we're doing. We also hear frequently, I have heard certainly all my entire career with person-centered practices, that's only appropriate for one type of disability. And typically people think person-centered practices are for people with IDD. But it grew out of the IDD community. It works everywhere. It just works with human beings. So I actually began my person-centered career in the field of aging and was only working with people who were older adults in long-term care, or they were working, they lived in the community and needed services and supports. We also sometimes think that only the people who are doing the direct work need to be person-centered. So only staff needs to be trained in person-centered skills. And that's not true. Our agencies need to be trained in it, our managers, our administrators, everybody, basically from the people who sweep the stoop in the morning to the people who make the highest level decisions need to be trained in person-centered practices. It's also not simply asking a person what they want. Frequently, we can't answer that question. I think for most of us, we've had a time in our life when someone says, just tell me what you need or tell me what you want. And your first response is, I don't know, because you don't always know. And if you haven't experienced anything differently, that's a really hard question, because how could you know what even exists? We also want to make sure that we are not falling into the trap of believing that these are simple, small changes that we're making. These are significant organizational and system changes. Person-centered thinking, person-centered planning are a pretty heavy lift for most of us. And so we need to acknowledge that and put things in place to actually support ourselves to do it better. Quality person-centered plans, if your role is to supervise, if you are an administrator or a manager, you play a role in assuring quality in person-centered practices. And that means that your knowledge of person-centered skills is vitally important to the process. You need to know how those skills are used in direct support of someone, but you also need to know, as a manager, I can apply the skill in this way. Or how it's applied in the development of plans. You also make sure that services are quality and that they're monitored, and that the plans are aligned with the mission of your organization and the desires of the person using the supports and services. So this is a lot that you have to pay attention to. But when we're writing good quality person-centered plans, we're doing that so people can get better lives. And it means that that plan reflects the person in the center of the plan. How do they have control about the life that they see for themselves, the life they've chosen for themselves? How do they get recognized and valued for all the wonderful things that they do, the things they've done in the past, the things they could do in the future, what they're currently doing? And that people are having lives versus lives constructed of services that are chosen for them. So when we're thinking about all of that, it has the impact of maybe avoiding duplication of services. And that, of course, has an impact on cost, the bottom line. And we all worry about that all the time. Our resources are so precious. We have very few people to do the work. And as I said, there's no more money coming. So I shouldn't say that. Sometimes additional money gets found in the system, but certainly over 30 years, the one refrain that I hear on an annual basis is funding is being cut. And I think that that's something that most of us have become accustomed to, but there's still an expectation that we're person-centered in the way we support and serve people. So the HCBS rule, plainly put, is about helping people make choices from a place of information about what might be the options available to them. So who provides their services and supports, what services and supports they even choose to have, where they live, who they live with, what they do with their time, including whether they're going to work or volunteer or spend their time some other way during the day. And what they do with any of the resources that they have. So it could be money, it could be time, it could be other resources, anything you can think of, really. And as we think about that, thinking about choice, it's really important to understand that I could be really happy because I got everything I wanted. So everything that's important to me that sits on my heart, I could just have that without thinking about that in the context of what's important for me. So I would be happy, but very unsafe. So unsafe and happy is not desirable, but we also don't want people who are bubble wrapped against all harm. So I can keep you perfectly healthy. I can keep you perfectly safe. That's pretty unacceptable because you're likely to be miserable in that situation. And in addition to that, people who have risks that we're trying to address in working with them may present significant risk to others. We have obligations to others besides the people that we serve as well. So we often have to modify plans to address those risks, and we'll talk a little bit about that as we go through the training as well. So an easier way to say this, and it's something that I almost always say in training is, you can be perfectly healthy and perfectly safe, but if you're perfectly miserable, I've completely missed the mark. I really want to pay attention to what creates balance in a person's life from their perspective, not from my perspective. And there's some challenges that come along with choice. It seems like all you have to do is ask people, and everyone has preferences. So we find out what they like and they dislike, and we think about what needs to be absent or present based on that, and we help them get it. But that's not so simple. Because there are many reasons for that. One, probably many of you are thinking right now, but I work with people who can't tell me. They don't use words to talk, or they don't communicate in ways that are typical. So we have to use our person-centered skills in those cases to listen for understanding to what we see people do. And we have to listen to the people who know them best. But in addition to that, when someone has never had an opportunity to live anywhere but where they currently live, how do they know where they want to live? So that might require some exploration and some reflection, and that would be a very hard question to answer if you've never had any other experiences. You may have to try new things to determine what you want. How many of you are working in the exact job that, if you've been in the field for any longer than a year, you're working in the exact job that you took out of college? Most of us try new jobs every once in a while. So for some of us, we're on a 3-year cycle, and some of us are on a 7-year cycle, and some of us maybe make it six months at best, right? So we try things because we're figuring out what works and what doesn't work for us. And that's how we learn about balance in our own life. But we don't often give people who use services and supports those same opportunities to learn that way. So they may need to try new things as well. People may communicate in ways that are atypical, so we have to listen in ways that are different than we may be accustomed to. If a person has experienced trauma, and we should assume that anyone who uses services and supports possibly has experienced trauma. And I'm talking about from the big stuff, so we call big T trauma, the stuff that you would all expect when I say the word trauma, to little t trauma, which could be not being listened to for over the course of your life, or every plan that's ever been written on your behalf doesn't really reflect the life that you want. That's a trauma that impacts how people express the choices that they make. Sometimes what people want is risky, and we can't support that, or we can't figure out how to support it, or we shouldn't support it because it doesn't align with our values and helping people stay healthy and safe. And that is what we're in the world to do. But we want to do that from a perspective of the things that are also important to them and what we want changes over time. So there are things in my life that I have today that 5 years ago I didn't know I wanted, right? And that's true for all of us. That always is something that's ever shifting. So if this is hard for all of us to answer, to think about balance from our own perspective, think about how hard that is when we're working with others to understand the balance from their perspective. So planning has to reflect the home and community-based setting, and it's integrated into services and supports in the greater community to help the person be as autonomous as possible in the setting that they want to be in. But in addition to that, when we're juggling all this, it creates for us kind of this tension, right? We all have the right to make our own choices, even bad choices. I'm not going to tell you about mine or ask you about yours, but I know you've made them. We all have. And we are in the business of looking out for people's health and safety. So that creates conflict or tension. And where there is good support, it lies in finding the balance between those things. So we'll talk more about that in just a moment. But I want you to first talk with one another in thinking about what challenges you as you're helping people explore the choices available to them. Where do you have difficulty? What's hard about that? So we're going to ask you to go into breakout rooms for, I don't remember how long. 12 minutes. Kirsten, what do you think? All right, Kirsten's going to put you into breakout rooms. We're going to remind you of a couple of things. Turn on your microphone so you can talk with one another. Turn on your camera so you can see one another. If you can do neither of those, everybody's responsible for going to the chat and chatting through typing with one another. When you come back, we're going to ask you to share what's on your mind, what you talked about there. So have a good discussion, and we'll see you back in 12 minutes.
Alrighty, you should see the prompt for the breakout rooms right about now.
All right, I think that's everybody back.
Okay.
All right, welcome back, everyone. All right, so let's talk about what you talked about in your breakout rooms. And if you heard my voice come through, great. I'm not sure I quite did it right, but we just have the ability now to broadcast on Zoom, so I was trying it out. Let us know what you talked about in terms of what's challenging for you. So you can do a couple of things. You can turn on your microphone and just speak if you like in the main room, or you can use the chat to tell us what you talked about. What did your colleagues say? What did you think about that? So what are some of the challenges that you have experienced when you're exploring choice with people? What makes it difficult?
I can only say for me, this is Donna Slavin.
Hi, Donna.
Hi, how are you, Tanya?
I'm good.
Good. I can only say for me, I'm in a program with, and have been for God knows how many years, with Alzheimer's, all the different dementias. It's hard for me because staffing is limited, and to do individual plans, and really there's, let's say you have 11 clients in, so I do a day program. These people, cannot really, some of them can articulate, some of them can't, to find what I can do individually to help them. So I do rely on family.
That's it.
But sometimes the family's expectations are not the same as what I see as the individual.
Yeah, and that puts you in an awkward spot, doesn't it?
Exactly. And that's challenging, very challenging.
Yeah.
I can only say that I have one gentleman whose family was insistent that he join coffee clutches and all that kind of stuff, yet he had no understanding of what it was, and it was through virtual. And I was like, okay, this is not going to work. But
so that's layers of challenges, right? So it's not just, the social challenge, but also the technology challenge, and you're not there to support him, at the same time. So
right, and that's the most challenging for me, is because I can't get them some of them can articulate what they want to do. If I say to them, today I give two choices. Today, would you like to do this or would you like to do that? Sometimes they don't have any idea, and they'll say to you, I want to go home or I want to go sleep.
Yeah.
So that's not an option. So it's very, very difficult. Very difficult.
Yes. And, many people, Donna, are experiencing that just for all kinds of reasons. I think the pandemic made some of what we have to do harder, some of what we have to do easier. Everybody had different experiences with it. But yes, I think my entire career, even before I ever considered using person-centered practices, there were still folks for whom it was hard for me to know what they might want because they couldn't tell me. And it was pretty clear that whatever their family wanted for them was what their family wanted. I wasn't sure what the person wanted. So it does put you in a very awkward. Thank you for sharing that, Donna. And I bet there are many people out there who are thinking what you just said. So who else out there? What were the other challenges that you identified maybe in your room or in your conversation? Put it in chat for us or just turn on your microphone and speak if you don't mind. Any other challenges out there?
One of the challenges that were discussed in my group were the challenge of the staff wanting to protect, so not having the person make the wrong choice, but protecting them from their choices.
Mm-hmm.
Yeah. How many times do we find ourselves, and you don't have to actually answer this question, it's hypothetical, but how many times do we find ourselves thinking, oh, that's not what I would want for you? And even though people do have the right to make bad choices, we also need to be really careful that they're not making choices that are risks that we can't support. So it does, there's a lot that we have to explore with that. So thank you, Nancy. Acknowledged. Yes, absolutely. All right, so I'm going to move ahead. I know that there are others. Please use the chat, if you will. I want to make sure we stay on time, but use the chat if there are other challenges that pop up. And I'm going to talk a little bit more about the choice, the control. I told you I'm changing my own language around that, really to think more about how people make decisions and how my role is to support someone to make a decision. The quality of choice versus the quantity of choice is one that we find ourselves exploring frequently with people. If none of the choices that are available to someone is a choice that they find desirable, then that's not really a choice, is it? So if I say to you and you're a vegetarian, I'm going to take you to the butcher shop for lunch and you can have anything you want. What are you going to eat? The parsley that's between the meat trays? I mean, there's probably not a lot in there that's going to be desirable to you. Where sometimes people want something that doesn't exist, we might know that we can develop that, but it will take time. And it also means that we also have to be willing to assume some risk sometimes. So and explore that with people. And that can be really scary. And as Donna pointed out, resources in terms of staffing maybe doesn't exist. And that creates another level of challenge for us. So if you think about it, we may find ourselves challenged to develop new services because the things that we have available are not things that people actually find desirable. In addition to that, sometimes people have others helping them make decisions. And so we are tasked with using substituted judgment. That's actually the law around it. But for the learning community, our real desire is that people are making supported decisions. So having the information available to them that connects to the things that sit on their heart that are important to them so that they can be supported to make the decision that most reflects the balance that they want. So what we should be asking is, what would the person want? And how could we honor those wishes while accounting for their health and safety at the same time? We know that that's challenging because sometimes when we're working with people, whoever is helping them make decisions expresses what they want for the person, but we don't really feel sure that that's what the person wants for themselves. And we really do have to honor what the person wants. And it puts us in a situation of like, how do we find out? That's where I think our person-centered skills are brilliant, because I think that when we kind of understand through relationship with a person and conversation with a person what sits on their heart, we have a much better chance of creating options that connect to the things that are important to the person. And we feel more confident that the choices we're offering are actually those that connect to those things that are important to the person. I'll give you a real quick refresher about important to and important for. You've seen this in all of our trainings, and my shortcut for this is the stuff that is important to us. This is the foundational concept for person-centered practices. It sits on our heart. It keeps us happy, comforted, satisfied, fulfilled, uniquely who we are. And if we took it away, we just wouldn't be ourselves anymore. So it's the stuff that's at the core of the person. And it would include all the things that you see here on the slide. So relationships, people to be with, status and control. We all have a need to be esteemed by the people in our lives. Things to do, places to go, things to have, rituals and routines, the pace we live our life at, and the things that give our lives purpose and meaning. Versus the stuff that is important for us. So often what we do in our field is really focus intently on what's important for us. So it's issues of health and safety. We are in the world to help people stay healthy and safe. The more nuanced piece of that is about helping people be valued in their community. So Donna talked about working with people who maybe have Alzheimer's. You know, in that situation, a person may have lost sight of the things that matter most to them because they cognitively don't have that anymore. But we need to make sure that they stay connected to those communities that mattered to them when they did have that notion. So, for example, if someone is going to their church on a regular basis, maybe you're supporting someone to go to church, and you pick them up in the morning and they're wearing a house dress with, you know, egg on it from breakfast, and they're in their bedroom scuffs. You might even explore with them, would you like to change into something else? Can I assist you to change into something else? Because we're trying to think about what would help that person be valued to that community that they've always been a part of, that it's been important to them to be a part of. Because if we show up at church with them wearing a house dress with egg on it and their bedroom scuffs, even though church is a place where we say, come as you are, people are going to say, have you seen Donna's grandmother? You know, we're the people who love and admire her or like and admire her. So we haven't paid attention to what helps her be valued in that environment. So important for is a little bit more nuanced than just health and safety, but it is what we're in the world to do. And so how do we do that in a way that balances it with those things that matter most to the person? So the way we teach person-centered practices in organizations, and this is getting into the real managey stuff of this, is that we teach person-centered thinking training, which we hope with practice leads to person-centered practices across an organization, which helps your whole organization be more person-centered, which can help the system be person-centered. So this is kind of the general flow of it. The skills we use are the same, whether we're teaching people who are doing direct support or we're teaching administrators or managers. There are skills that help us do discovery with people. So we call those discovery and listening skills. And it's about getting to know what's important to a person at the core of them. There are skills that we use as everyday learning skills. And I will tell you, as managers, those are probably your most powerful skills. I'm going to actually have you practice with some in a bit. And then there are skills that we call management skills, which are not just skills for managers. Those are skills about managing our roles in a person's life. And all of that is built on the foundation of the balance between important to and important for. In fact, we start with important to and important for, and we shouldn't do any of the other skills or problem solving in partnership or otherwise until we've considered important to and important for. So we can consider that on an individual level, but we can also consider that at an organizational level or at a systems level. If we're going to be person-centered, it requires more than just training people. And I think that's where we often make some mistakes. We, the system, not we in this room, but kind of from a big picture view. We just train people and we say, okay, they've got person-centered training, therefore they are person-centered. And that's not how it works. They need to be exposed to the skills be able to use the skills so that they can develop confidence and competence with them, and then be coached to use the skills on an ongoing basis so that we take the skills from exposure to habit. We want people to just kind of automatically have that switch turned on in their brain so that everything they're doing is from a person-centered perspective. So formal and informal training leads to structured practice, and with feedback that helps people be more competent. And then the reinforcement from that feedback leads to confidence, resulting in habit in our everyday practices. And we also can combine that with some dashboards that we already use. So I'm not going to tell you to go out and change all the measurements that you're already looking at in terms of your person-centered practices. I will ask you to consider whether you actually have any, because sometimes people haven't been paying attention to that. Like, you might have person-centered plans because you're required to, but are you looking at the processes that you have and whether or not they're person-centered? So how are you mapping the key processes in your organizations? Are you making changes in your organization based on person-centered expectations and making an organizational culture that is influenced by positive pressure for person-centered practices? And are you integrating that learning so that when you change your policies, when you change your structures, when you change your practices, it's because your person-centered practices have told you that that's the direction that you need to go in? So some of the values of looking at it from that perspective, and I'm going to give you a skill in just a minute, or I guess a conversation that you can have to help you do that. One that I want you to go back into your organizations and have with others. But when we're aligning person-centered values with our behavior in our organizations, it can really help us think about not just quality of life changes for each person that we support, but we will also see things, and there is data to back this up, like fewer behavioral incidents. We will see fewer injuries. We will see decreased staff turnover. If there is one person on this call who is not interested in how to keep and retain staff and sustain the staff that you have, how did you do it? Because everybody right now is having that conversation. And it's not just a matter of staff satisfaction. That's a big part of it. But there are big issues in our system right now. So decreasing turnover is something that everybody's looking at. Shorter meetings with better outcomes, business processes that are sharper because of your person-centered practices. I will tell you that there was a big multi-state managed care organization that I was working with who looked at their assessment processes with the assistance of my company and the learning community skills, these person-centered skills we're talking about. And their assessment was over 1,000 questions long. So this is just their assessment. This is before a person has even gotten into services and supports. It had all the right person-centered concepts in it. It was embedded all the way through the assessment. And they were buried in there in such a way that they weren't highlighted in any way. One of the things that this organization did is a very simple things. They just moved the one-page description, which is a person-centered skill, to the front of the assessment. And they used some of the person-centered discovery skills right up front. So it was like a one-page description, a few person-centered discovery skills, and then they put what they like and admire about the person, or what others like and admire about the person, right behind that. So the first things you were introduced to in this assessment were all person-centered skills. And all of a sudden, employees were saying, oh, this is much better because we get to know people up front and we feel ready to partner with them in problem solving. And we start with people's strengths right off the bat. And that helps us understand what are the unique attributes this person brings to the conversation, and how do we use that to help the person overcome the challenges they're facing. So it's a simple shift that they made. They already had all this stuff. It was just that it was hidden in a process that kept them from benefiting, kept the person that they were working with from benefiting from the assessment process. And that's often what we ask people to look at with your processes and procedures. Are they painful for the people who you are supporting and serving? Do people tell you, oh, I hate planning. I hate the planning process. It's the worst part of the things that I have to do with you all. That means that you have opportunities there to be more person-centered in the way you approach it. So I'm going to ask you to think about that in terms of how you're doing right now. I'm going to show you 3 arrows that are continuums. And the first one here is around looking at the people who use your services and supports. So if you think about every person, maybe that a department in your organization serves or your whole organization serves, maybe imagine that you had little sticky notes with everybody's initials on it. And you just said, I think this person fits here on the continuum, and I think this person fits here on the continuum. And you covered this arrow over with sticky notes. Where would people show up for your organization? So from a service life, which is at the blunt end of the arrow, meaning that a person is being served by your organization and you're paying attention to what keeps them healthy and safe, but you may not be making any organized efforts to pay attention to what's important to them. And I don't mean you specifically, but I'm talking in grand generalizations here. So a service life is where there's no expectation to pay attention to the stuff that sits on the person's heart. We're keeping them healthy and safe. All the way out to the tip of the arrow, which we would call a community life. And it could even be beyond the tip of the arrow, where we're paying attention to what is important to a person and what's important for them. They have a circle of support from people who matter to them around them. And it's not just people who are paid to be in their life, but people who are natural supports in their life. So who's unpaid, who's in their life. And they're included in community life, meaning if they don't show up somewhere for something that they like to do, people miss them. In fact, somebody may come get them, so to be sure that they're a part of it. So everybody you support fits somewhere on this continuum. I will say that most people show up kind of to the left of a good paid life. And so that's in the center of the arrow there. Most people who use services and supports in the U.S., we think about maybe 85 to 90% of people show up to the left of that. And that's not a bad place to be, because we're paying attention to important too. And we're balancing that with important for. But the big issue there is that the connections are not as strong or real. So the people who are closest to the person are people who are paid to be in their life. And so we want to focus more on how do we help people have true relationship out in the community. So that's people supported. But we can also look at this same continuum for the employees of your organization. So from a place where we're meeting the minimums and we're keeping people healthy and safe, we take people out into the community because that's expected of us, but we don't really connect with others while we're there. We try to be all things to everybody who is a part of our organization. So everything is really focused on the services and supports. And we record information, but it's information that makes the monitors happy. It's not necessarily what we're learning from supporting a person. And we may not even really feel valued by our organization because we're learning and listening as we work with people, but that information doesn't get used in any way. So it just is kind of lost all the way out to an organization that's more person-centered, where staff know that what they're learning is an important part of not only helping people have better lives, but it's used in the organization to help the policies be more person-centered. Staff can say, I can try things, I can even get things wrong. As long as no one gets hurt, I'm being creative, I'm not fearful of that. And it's expected of me, and I can tell the organization how it's working. They feel there's a good match between them and the people that they support, and they know what's important to one another. They know what's important to the organization. And we can also look at this same continuum for the person-centered organization itself. So an organization that is just meeting its minimums on the blunt end of the arrow is they're training people in the stuff they must train them in. So fire extinguisher, CPR, I can't think of all the mandatory trainings. I know you have a billion of them. Even probably how to fix up mop water so that you can mop the floor appropriately. All of those things are being trained, but the training is not really about skill development that's focused on person-centered practices. It's more about compliance with regulations, and we're making people independent, and we're keeping them healthy and safe. All the way out to the organization that's more person-centered, that's building all their processes around person-centered skills. Everything they learn gets injected back into the organization in terms of making policies and procedures stronger. We're partnering with other people inside the organization, outside the organization. All the managers, all the coaches are using the skills continuously, and all of our strategic approaches are informed by our person-centered practices. That said, I'm going to ask you to talk about this for only your organization today. Now, here is the departure I'm taking from the way that we usually teach this, and I'll tell you the behind the scenes tour of this. Usually I say start with the arrow for the people that you support. Because if you know that everybody that your organization is supporting is at the back end of the arrow where it's blunt at a service life, that tells you something about how you're doing organizationally. We're going to flip that on its head today, and we're actually going to start with your organization as a whole. And here's a couple of just caveats for you. This is about hunches that you have. It's not hard and fast science. No one necessarily needs to see what you're doing in your exercise today. So if you feel like, oh, if I say this out loud anywhere, I'm going to be creamed, no one needs to see it, but you are going to have conversations with one another. And I want you to be able to do this because it's important to be able to go back to your organization and have this conversation with other people and share those hunches with one another. So as a group, you can say, I feel like this is where we are. So then what you would do with that is actually develop outcomes for the three groups. If you know where the people that you support are kind of as a whole in your organization, you can say, this is how we would like it to look different. And the same is true for employees, and the same is true for your organization. We're not going to go that far today, but I want you to actually start with getting a baseline hunch of where you think your organization is. So you have handouts for this. It looks like those arrows. And I want you to only work on the organizational arrow for today. You're going to work in a breakout room. You can have discussions about this. I will say we're popping in and out of the breakout room. One breakout room was mighty quiet. I would encourage you, please, to engage with one another in your breakout rooms and really get the most that you can out of this exercise. Find the organizational arrow. And all I want you to do is make a mark on that arrow, an X, a check, or whatever, wherever you think your organization is. But then I'd like you to talk with one another about why you think you're there. I'm going to ask you to do that for, let's say 15 minutes, if you will. And then when you come back, I'm specifically not going to ask you about that experience in terms of where you are, but I'm going to ask you about the overall experience. So you are not going to have to share anything that makes you uncomfortable. So in your breakout rooms, put an X on your organizational arrow, tell others why you think you're there, have a good discussion, and we'll see you back in 15 minutes. If you have any difficulty, let Kirsten or me know. We'll help you out.
You should see the prompt now.
All right, so it looks like you are all back now. As I said, I'm not going to ask you to tell us where you are on the continuum from your best estimation. I am curious, though, what your experience was in using that graphic to kind of think about that with other people, or maybe think about why you thought that. Is that a conversation you think you could have now at your organization? So just let us know what you think about that. You can turn on your microphone. You can let us know by putting it in chat. You know the drill.
Well, I can share if you can hear. Can you hear me?
Yes, absolutely, Paul.
All right. I don't know if you can see me. I think
we can. Yes.
Okay, good. I can't see myself.
Looking good.
All right, thanks. I was sharing how the conversation about the organization and where our department stands. I work for a hospital, and our department is the case management department. And how before the pandemic, Kirsten was reminding me that even before the pandemic, we had some issues around staff collaboration with the supervisors and some breakdown in communication. We had some minor staff turnover, and we've since, I've since provided some more detailed communication and collaboration with the team leaders to make sure they have the supports they need to supervise their staff, and they're having active training at the beginning when people are first hired, that staff are supported. And we also have, I've now implemented stay interviews, exit interviews, and staff satisfaction surveys, primarily a stay interview and an exit interview. And we're going to do a stay interview like in January for all of our department. So I've discussed that with our administration and they've actually used the stay interview for other departments in the hospital. So, sometimes when there's a breakdown and things don't go well, if you can take a look at it and what we can do things differently moving forward. And that's what we've kind of tried to do. And I would describe our department around the person-centered area where we try to meet our staff where they're at, and we try to get feedback from them on what they think we're doing well, what they think we're not doing well, and try to address that and make corrections and make modifications for our department. So that's a little bit about us.
So, Paul, I have to say, I mean, that's really impressive. And one of the things, it's a hunch, and it may sound like a silly question, but have you noticed that just supporting staff harder from the beginning, like really coming in from the very beginning with training and the expectation that you're going to check in with people, a stay interview, those kinds of things? What kind of a difference has that made sort of in your morale and in your culture of your organization?
Yeah, so within our department, at least, it's made a big difference. So, throughout the pandemic, we really haven't had very much staff turnover at all. And the team leaders primarily have very productive communication with their team members. And the morale is much better than it was maybe like going back 5-10 years, where there used to be a lot of, you'd walk into the offices and everybody all of a sudden becomes silent and quiet, and they'd be huddled around complaining. And we'd hear from some staff that people were complaining about this one and that one. And then there were these letters that anonymous letters people sent around. So all that has changed, and the atmosphere is much more positive now.
That's very encouraging. And that's exactly what the point of these conversations are. You could now go back then, and I don't know if you feel that you could do this, but it sounds like you have an environment where you could then take this arrow and say, this is my hunch, what's your hunch? And just have people kind of collaborate to get a good sense of where you think you fall in terms of a baseline. And you can do that for your employees. You can do it for the people who your departments support, which I would assume is a pretty broad amount of people, given that you're doing case management at a hospital or care coordination at a hospital. But when you think about that, these conversations really help us have hunches about where we need to improve. And that's the point of these. So I'm curious from anybody else, any other thoughts you'd like to share as a result of your conversation in your breakout room? Is there anything in chat that?
Hi, Tanya. It's Stacy. Ironically,
hey, Stacy.
Paul is actually my director. I didn't know he was on the training. So I'm one of the team leaders he's talking about, by the way. I agree with everything he said. In my breakout room, which he was not in, by the way, I said the same thing. I do feel like we are person-centered in our approach with our staff. The only thing I think Paul did not mention, which I mentioned in my breakout room, was that I initially was a case manager. And being a case manager before being promoted to a team leader gave me the skills that I needed in order to support my staff and to be able to have different ideas that are person-centered. And having someone like Paul that was a case manager as well and was promoted to director, and I could bring to him my ideas and my thoughts on supporting staff throughout the pandemic and even prior to that, I think that speaks volumes. And I think that's why we retain so much staff, and we really don't have any turnover aside from people graduating and moving on that way. So yes, I do agree with him.
Thank you, Stacy. That's nice to have some independent confirmation. And also, if you can bottle how to retain staff, that is what everybody is going to be wanting to buy, right? But that, I mean, you hit on a lot of the things. You understand the unique role of case managers in your organization because you've done it, and so has Paul. So a lot of the changes that you have made have been informed by those experiences, I'm sure. All right, so I'm going to keep us moving. I wish we could spend a little bit more time just hearing from other folks. Please put in chat anything else that you'd like to say as a result of that. I know these conversations, I always feel like if you felt sensitive about anything, it could be this, because we sometimes realize, oh, you know, this could be different or it could be better in our organizations. We want to be further along than we are. But starting with where we think we are is a great conversation to have with others. It's a collaborative and person-centered way to understand what's important to and important for our organization. And it can help us kind of move forward together with everybody looking at the same things. That's why I love this sort of continuum arrow idea. There's another thing you could use. So we call this homework. And I really do hope you'll go out and look at this. It does not take very much time to do it. If you have not looked at the National Centers for Advancing Person-Centered Practices self-assessment for person-centered organizations, this has a series of questions. The link is here for you where you can actually check out your hunches. So Paul and Stacy, one thing you might do is go back out to this NCAPS assessment, take it and see where you are on these variety of areas. So there are, I can't remember how many areas there are. There might be 8 or 9 areas in the self-assessment that look across your organization at where you are person-centered and where you have opportunities for improvement. So it's going to help you move from having that hunch to having some things that you can actually measure together, which is going to help you understand what your outcomes need to be. And again, you do this in conversation and partnership with others. Can I post the link there? Possibly. Kirsten, would you be able to do that? Possibly post the link in chat? Okay, thank you. It's a great assessment, and there's lots of background information for you there as well. And NCAPS has tons of resources too, so please do go check them out. I'm going to keep us moving just to make sure that we end on time. I know no one wants to stay late. I want to give you a few more person-centered skills as managers that you can focus on that may help you align your policy and procedures and practices with person-centered values. So the two that I think are most useful for managers, most useful for managers, are the works make sense, doesn't work, doesn't make sense analysis, and 4+1 questions. We would call these everyday learning skills. So the first one, the working not working, is a great negotiation skill. This can really help you like peel the onion, look into a situation kind of layer by layer. It doesn't only work when there is a disagreement, but it's remarkably powerful when there is one. So if you've done a really good job of looking at perspectives, and that's what this skill is, it's a perspective taking skill. Everybody feels like they've been heard, and it helps you find out where you have common ground. And it also helps you understand what your next step should be, because it tells you what should stay the same and what needs to change. So this is a generic example of that. I'm going to show you an actual example of it in just a moment. On the left-hand column, we look at what's working and making sense from different perspectives. So in this case, we'll just say it's a person being supported and the staff. That's the generic example. What's working from the person's perspective, what's working from the staff's perspective. When things line up under what's working for both perspectives, it's working. Do more of it. If it's not working from the person's perspective and it's not working from the staff's perspective and it lines up, it's not working. Why are we doing it? Let's do something different. So that's what changes. But what almost always happens is something's working from one perspective. In this case, the staff says this thing is working, and the person says, no, it's not. So you have this disagreement that shows up on the diagonal. Case managers, care managers, put your hands on either side of your ears so you can hear this very intently. That is always an outcome. Whatever shows up on that diagonal is always an outcome, because if you're planning with people, because that's where everybody has energy invested. It's where it tells us where we need to head next. So that is really powerful information for you. This is what it looks like if you think about using it as a evaluation skill for those of you who have to do evaluations of your employees or yourself. You might look at the manager's perspective, the employee's perspective, and the perspective of the people who are using your services and supports. And you ask what is working and what is not working. This is not a skill that is about anything but what's going on right now. It is not about what could work in the future. It isn't about what did work in the past. It's about right now. If we took a snapshot of this, This is what presently we see. And you make sure that you use as much as you can the words of the different people in the conversation. So capturing Kirsten's words in the way she says them is much more powerful than me interpreting what she said and putting it into this tool. That has a lot of power because Kirsten's going to feel more heard and respected if I can copy down what she just said. So let me show you an example of a large managed care organization I was working with who was doing a person-centered organizational initiative. And they developed a new electronic intake system. And the great thing was they had an IT department that could do everything. And those guys were really sharp, and they said, we can make assessment go faster, or we can make intake go faster. The intake staff was awesome. It was a very small group. They were doing everything kind of the old-fashioned way because that was the system they have, but they were a flexible team. They were very experienced. Intake went pretty smoothly. And what the IT department said is if we develop this electronic system, it's going to be even faster and more accurate. And so what happened was the IT department developed the system and it crashed everybody's life. The intake staff was now in trouble because it was taking longer to get people through the intake process. The IT department was getting yelled at by the administration and the intake staff. The IT department was saying the intake staff was, I'm going to use the word stupid. It's not my word, but it was their word. You know, they can't figure this out. And the intake staff said, we didn't get training on it. And the administration said, everybody's unhappy, including our customers. And so it was like a big blah, blah, blah. So they sat down and they did this really on their own because they were going through person-centered organizational work and figured out that the big issues with this is the system was actually a good system, but because the intake staff didn't get the training that they needed and also didn't get consulted about how things should flow, that it needed some tweaks to be able to make it usable for everybody. And once they were able to kind of look at where they agreed on things and where they did, you know, where things did not work from everybody's perspective, but where those disagreements showed up, they very quickly honed in on a couple of things that they could quickly fix because the system was pretty flexible. And it absolutely did change how they do intake. It was much faster. It was more accurate. It did make their customers more happy. But if they had not had this, what they were in was like this blame game thing, right? So they're arguing with like, it's your fault, you know, and so then nobody's happy, including the customers. So I love this skill. I think it's a great way to solve problems in partnership with one another. And I would encourage you, just based on what you're seeing in this training, to start to use it. You don't need to know more than that to have a good conversation with people about taking perspectives. What you can't do is, again, think about the future or the past. You need to think about just the present, and you need to make sure you're capturing exactly the other perspectives. There's amazing power just in having that conversation, and it immediately pops things up to the surface about where you need to focus your energies. People will be invested in that disagreement for different reasons, but everybody's going to be invested in it. 4+1 questions is the other powerful skill that I think managers often find themselves using. It is used to evaluate everyday situations. To me, a 4+1 question is always a look back. It's like what we've already done. It can be really useful for you in a management role because what we do is pose the question that we want people to answer, and then we all focus in on it. So we do it in partnership with others. This is a great skill if you have folks that you know have great ideas and solutions, but their elbows aren't sharp enough to get in on the conversation at the table. Or if you find yourself in meetings, and I came out of a university setting many years ago, and every meeting I ever went to included someone who said, we already tried that and it didn't work. So if you had a solution for anything, somebody had the way to slap that down. This will shut that down. So it's a way to get everybody to share what they know. And the questions are simple. You don't have to explain them in any way. What did we try related to whatever this question is? What did we learn? What are we pleased about? What are we concerned about? And after we've looked at all 4 of those questions and we've done an analysis, then we say, what do we do next based on what we know? So it's always done by first posing that question, and the better you are at targeting the question you want people to look at together, the better information you're going to get out of this. So again, use it as a look back at something. I have used this to evaluate conferences. I've used it to evaluate policies and procedures. I've used it in so many different ways managerially. In fact, I've probably only ever used this managerially, although many people who are in direct support roles absolutely use this every day as they engage with people and learn from them. So you might look at it. So we were talking about how hard it is to retain employees. You might ask the question, what have we done to improve employee retention? So you could ask these 4 questions and get a really good idea about the kinds of efforts that you've undertaken and which of those have had some promise and which things are you still concerned about. And once you have a good understanding of that, it helps you then move on to decide what you're going to do next. So I would ask you to, if you're having this issue where you are and you have some say in that conversation about employee retention, could you sit down with a number of people and just have a conversation about what you're doing? So Paul and Stacy answered a bunch of these questions just in reporting out about the first breakout room that we had. They could easily do this. I could help them do it right now. Because those questions are very simple to explore together, and you've certainly done some things to improve your employee retention. I'll show you another organization who said one of the biggest issues people were having that they supported, and this was an organization who was doing formal person-centered organizational work, was that they were trying to get more people into the community, and not just into the community like where you take them on the mother duck tour of Walmart where they all hop off the bus and, you know, march through in a big clump, but truly getting out and doing things that give people purpose and meaning. And so they were trying things about working intently around important to and important for at an individual level. So Donna said, you know, I'm supporting 11 people and I don't have enough staff. How do I individually, you know, understand what each person wants? So they were really digging deep into that same question, and many organizations do. They were using their person-centered skills to understand that, and they were actually getting together on a quarterly basis to focus on community and what that meant where they were and the things that they were trying. And what they learned from the process is that not everything they tried worked, that they had to keep focused on it and keep trying things. But the agency has to value the importance of having purpose and meaning in the life of every person that they support. And when they kept that as their focus, it was very motivating to employees, and it made them be more creative. They really thought harder about what people were experiencing and what would give people more purpose and meaning. And they also understood that they supported people who needed to be supported differently in different situations. So it meant that they had to really focus on each person's needs, those kinds of risks that might come along in supporting people. They were very pleased with some of the relationships they were making. They used the skills well. That really helped them make progress in that area. And one of the things I love that they said when they were working through this was they really allowed themselves to be surprised. And that was part of the power of this. So they would tell stories about where it was working in their community and where they were still finding challenges. And they had staff who were really willing to be brave and try things that as an organization they had not done in the past. But what was concerning for them is that staff turnover obviously meant that it would take energy away from staff when they lost people. They never felt like they were ever done. It was always something that they had to focus on. And as people changed, as they aged, as situations changed in their life, they had to change the efforts to go along with it. I think this is a great example of how this skill can be used. And we use this with permission of North Star Services in California. They actually were the organization who was going through this, and they don't mind that we talk about them. This ties really nicely back to that continuum for people supported. So if you went back and you looked at that and you said, for every person that we support, where are they in terms of having purpose and meaning? Where are they in terms of living a person-centered life? This is a nice way to kind of pull that information in. And often these skills get used together. So savvy managers will use person-centered skills in conjunction with one another because they can really inform or to help you figure out what you're going to do next based on what you understand. All right, so we're getting right at the end here. And I want to make sure that we have time for this question. I'll ask you to use chat or turn on your microphone. It's helpful to think specifically about what you're going to do as a result of the conversations we had. It's very nice that we spent 2 hours together today. I always like doing training with you, but so what? If you don't go back and use what you learned, what have we really done? And I think that's the important thing about these kinds of experiences is to take something that inspired us and go do something with it. So if you're going to be more person-centered, that begins with you. What's the one thing specifically? What's the one thing realistically that you can do with your organization as a result of the conversations that you had today? So I'll pause for a moment, ask you to put that in chat, turn on your mic, tell me what you think about that. What can you do specifically and realistically? Anybody got any ideas, any thoughts about what you will do? What you'd like to do?
It's Nancy. And for my team, we've been talking about looking at different processes and making them more efficient, maybe more productive. So when you showed the 4+1 questions, actually using that when we are looking at different things, should we change it? Should we keep it? What else can we replace it with? So that was my thoughts.
That would be a great way to use 4+1 questions, Nancy. And I'm going to share a resource with you all in just a moment where you can get you can pull down what we call the forms that we teach person-centered thinking with. You could pull those down in a blank format so that you could use it with your team. You can also see examples there. So please don't hesitate to go out and get that. We want people to use those.
Okay, thank you.
Anyone else? What would you like to do specifically, realistically, to help you be more person-centered at your organization? Anybody going to go back and use the arrow with your department or the staff? All right, well, hearing nothing, I'm going to keep going. Please use the chat to answer that question. And I will share with you some resources that I think could be helpful. These are all person-centered resources. So the Learning Community for Person-Centered Practices, of which Kirsten is the executive director and I'm the co-chair. You can get lots of connection there. You can get examples. It's a great place to understand what's going on in the world of person-centered practices. And it's an international community. So you may be surprised at some of the folks who are doing this work in the areas that they're doing this work around the world. One-page descriptions are not something we talked about heavily, although I did mention them as an organization moved that to the front of their assessment process. This website has like hundreds of one-page descriptions, which is one of the first steps that many organizations take to help their organization be more person-centered. So you might actually focus with only your employees. Maybe, Paul and Stacy in your department, you might decide all your staff needs a one-page description. So there's examples of how you could do that. Or people that you work with who are going to be transferred maybe to community living or a facility of some sort, a one-page description might be a nice warm introduction to that person and the needs they have for support. The Person-Centered Practices Resource Library has hundreds of resources, great stuff. That's here in the middle of the page. And then you see a couple more here. We didn't talk about assistive technology, but if you are struggling to support people to be autonomous, often after the point of having a plan written, looking at assistive technology that may help them is a good next step. So we did include a resource for that there and on this page as well at the bottom. These are mostly from your area, so there are some lessons from the field. DOH did a webinar with folks who are using person-centered practices and some of their experiences. NYSOFA has an aging training resource kit. OPWDD has an online toolkit. And if you have questions about the HCBS rule and you don't know how it intersects your job or your world or your life or the people that you support, please go to the HCBS rule webpage and get that information directly from that source so that you're not getting all the myth and interpretation that comes from people in your field who may not have exactly the details correct. It's important that you get it straight from the source. The DOH training initiative, the additional training opportunities are listed at this website. So please send your staff, come back to trainings yourself. We would love to see you. I'm taking a peek in chat because I think a couple of things have popped up.
Just somebody missed the final question that you asked and also commented on your teaching.
Oh, thank you. All right, so we will leave that. But if you have any questions before we exit, please put them there. And then we'll give you just a couple more ways to stay in touch with us. Oh, Monica's not with me. It's Kirsten. Just ignore Monica or send Monica a message.
Absolutely. Monica would be happy to hear from everybody. And she is also a person-centered thinking trainer.
And my contact information is here as well. I do love hearing from folks. Questions about person-centered practices. Let us know how you're doing with them. Please be in touch if we can help in any way. Again, about the training initiative or the HCBS rule, you have contacts for that. And then just to say that these are sponsored by the Department of Health, the New York State Department of Health. And the training content comes from the learning community and support development associates. And we do this in partnership with the New York Alliance and Public Consulting Group, who handles most of logistics behind the training. That said, folks, we came in 2 minutes under time, and I'm delighted that you were here with us today, and I'd like to thank you. Kirsten, is there anything you'd like to say in terms of just wrapping up today?
No, thank you. It was great to see everybody, and we hope to see you in another module sometime soon.
Thank you so much. I just want to say, Tanya, you're so great. Thank you so much.
Oh, thank you. Thank you.
The one thing that I want to start with, it's taking it to the board, discussing with the staff in the office. So we take it from there. Thank you so much. You've been so great.
Thank you, Yvonne. I'm glad you were here.
Thank you.
All right, folks. I hate to leave soon, but I have another meeting right on the end of this. So I'm going to say goodbye to you all. Kirsten, do you want me to just stop sharing and I'll just close it down altogether?
Yeah, we can close it down. Thanks, everybody.
Thanks all. Bye.